So I, like you, have been gifted with a ton of time due to this global outbreak of a strain of coronavirus that we've all come to know as COVID-19. One of many coronaviruses to break out and affect large populations of people in the last 15 years or so. This particular instance has proven dangerous enough that many authorities globally have resorted to quarantining entire populations, effectively seizing up national and global economies the world over, as many people have effectively become prisoners of their own homes. The economic fallout from this is serious enough that in the United States alone, several bailouts have been proposed that are designed to either sustain the economy through these tough times or restart it when this epidemic is past. But the question on many people's minds during the self-imposed moment of reflection is, how did the world get so caught off guard by what many laymen have described as a bad flu bug? Is the Chinese medical system at fault for not containing the spread of this? And what is the role of natural medicine in all of these things? We're going to take a look at all of this coming up, so stay locked in and be sure to like this video for the YouTube algorithm and drop us a comment on what you think about the Chinese Chernobyl and if the focus on natural medicine has led the whole world into a quagmire. What's up, you guys? You're watching BTP Fusion, where it's our mission to inspire you to take imperfect action on your finances and business through the power of technology. What's up, you guys? You're watching BTP Fusion, where it's our mission to inspire you to take imperfect action on your finances and business through the power of technology. I'm your host, Derek West. Let's dive right into the content, shall we? Chernobyl, a city in the former Soviet Union, now the Russian Republic, was the site of the now infamous Chernobyl disaster. Duh. A nuclear power plant meltdown that ended many lives forced the evacuation of an entire town and region, actually, and the surrounding countryside. It introduced tons of nuclear radiation into the atmosphere that ostensibly traveled around the globe and helped to stoke the panic and fear in generations of people who once thought atomic power was promising. The promise of using atomic energy, the second most powerful and energy-dense reaction currently known to science. Chernobyl wasn't a conspiracy. It was an accidental unleashing of the power of nuclear fission. And the lack of controls on that energy plant in Chernobyl ultimately led to the chain of unfortunate events that enabled the reactor to melt down and all the fallout, no pun intended, that occurred from there. The parallels with the coronavirus are similar, as we shall see. But to further understand this, we need to get an understanding of how the Chinese healthcare system works and what its role was in helping to stop the spread of the virus. Why the Chinese healthcare system, you may ask? Well, the most common theory for the origin of this particular strain of coronavirus is that it originated from the quote-unquote wet markets of the Chinese province of Wuhan. And the Chinese healthcare system first identified the virus in its people and was responsible for initially containing it and helping to prevent its spread. Now, I understand that there are a number of theories out there that suggest that this is some sort of bioweapon, either developed by China or the United States, in an effort to harm the other party in some sort of global sibling rivalry, tit for tat. In any case, to understand this, you need to understand the history of the Chinese medical system. Prior to the arrival of the Chinese Communist Party, much of the medicine on the mainland of China and East Asia in general was based off of Confucius medical practices. These practices, remedies, and cures were passed down from person to person for generations. Quite a bit of it was mysticism, and even more of it was anecdotal. Now keep in mind, this is not a slight in any way to Chinese medicine, as that is or was the case in a lot of medical systems across the globe at the time. Everybody has the same starting point. It's where we end up that counts. But following the Chinese Civil War and the victory of the Chinese Communist Party over the Chinese Nationalist Party, Mao Zedong, in an effort to bring much of the Chinese mainland into the modern era, well, he instituted many programs, one of which was the so-called Barefoot Doctors Program. The reason why it was called the Barefoot Doctors Program, even though the doctors were known to wear shoes, is unknown at this point. Perhaps because they were treating a largely rural population known not to wear shoes. Perhaps because the program was largely underfunded and thus a poor translation of a popular idiom. Like I said, I'm not sure. What I am sure of, though, is that the program was largely successful in that it helped to reach 90% of the mainland and mostly rural population with rudimentary healthcare services. Services such as assisting childbirth to reduce child mortality rates, administering vaccinations to help reduce the spread of pandemics and other health outbreaks, and even instructions on general sanitation practices that could help to increase the general health of the population. During the 80s and 90s, and following the death of Mao Zedong and the introduction of market liberalization programs, these barefoot doctors became somewhat antiquated. Since the economy had improved due to economic reforms implemented by Mao's successors, it became obvious that the rate at which people's health was improving was not keeping up with the rate at which the economy was growing. Along with the level of pollution and other environmental concerns, this was one of the largest problems of a growing China. Thus, even more reforms were instituted into the now growing country. Among the improvements included large-scale upgrades of their healthcare system, One of the issues of the Chinese and many other private healthcare systems is that because patients are charged for their visits, including for routine checkups and things like that, many people would just rather not go. In other words, it's a typical problem of market economies in that it illuminates inequalities among people. And thus, even though generally speaking, the entire population has a higher standard of living, in this case, particularly in the case of healthcare, there are people that are left behind, even chronically so. And that was certainly the case in the Chinese healthcare system, particularly in rural areas. It has been reported that a couple of days in a Chinese hospital can cost patients up to an equivalent of a 3-month salary. And on top of this, even if you have insurance, you're expected to tip the doctor if you want to be treated well. This level of cost for hospital visits has led to many cases of Chinese patients going bankrupt for their treatments of various diseases. And this has led many patients, healthcare practitioners, and policymakers to look for alternatives. And by alternatives, we're talking about returning to medicine as practiced by their ancestors and passed down from generation to generation. I, of course, am talking about traditional Chinese medicine. And this is not something that they hide or are ashamed of. This is something that they promote and are proud of, including the leader of the Chinese Communist Party, Xi Jinping. Xi Jinping has touted the efficacy of traditional Chinese medicine. In addition to that, the Global Times, the official mouthpiece of the Chinese Communist Party, has touted its efficacies and benefits as well. Traditional Chinese medicine is not something that even Westerners would be unfamiliar with. If you have ever heard of or visited an acupuncturist, participated in Tai Chi, or if you even had herbal tea, which includes many ingredients, including ginseng or echinacea, you too may have had an experience with traditional Chinese medicine. That said, the experience of many Westerners is to sort of be wary of these sorts of herbal and traditional treatments, as most realize that while they do have some benefits, their benefits can be anecdotal and inconsistent at best, and downright misleading and flat-out false at worst, which is not really a problem per se. If you want to incorporate these sorts of treatments into your regimen and you feel they provide health benefits to you, then, more power to you. A problem arises, however, when solutions such as these are seen as the only ways to get medicine. You see, China has been embarking on an effort to get more general practitioners into its notoriously overburdened system. In order to do this, the Chinese have a couple of different pathways to study medicine to be able to become a doctor. They have the traditional 5+3 pathway, which includes a 5-year Bachelor of Science degree in clinical medicine and 3 years of standardized residency training. They have the 3+2 pathway. This pathway can lead to becoming an assistant general practitioner, which requires 3 years of junior college and 2 years of clinical training. It all seems relatively reasonable, right? Well, the rural doctor pathway includes 1 to 2 years of training. Yep, that's right, 1 to 2 years of training. That is for rural doctors who have been practicing in their communities for a while. That is, for someone who's been practicing medicine with people in their community but may have not had formal training. And in those communities, they were more than likely practicing traditional Chinese medicine. Again, it's not a problem per se, but add to that fact that traditional Chinese medicine hospitals are the beneficiaries of campaigns to boost their presence across the country. And all of a sudden, you now have an environment where certain questionable medical practices may flourish. And as we've said before, there's nothing wrong with these medical practices per se, and they can be great in the right dosages and can provide benefits beyond traditional medicine's capabilities. That said, the outcomes of such medical practices tend to be dubious at best, and downright pernicious and false at worst. Well, so far it would seem that we've only succeeded in showing that the Chinese healthcare system has some major inefficiencies, and in an attempt to close the gap in healthcare coverage has relied on somewhat loosened requirements of entry for physicians, which generally speaking is not a bad idea, and may rely on poorly proven medical practices in some of its rural facilities. So far this isn't adding up to a Chernobyl-style disaster with Corona at its epicenter. Well, here's the problem. You see, for some unknown reason, quite a few traditional treatments require rare and exotic resources to treat ailments. Think animals and plants close to extinction. The search for and harvesting of these resources can cause ecological problems for ecosystems in which those plants and animals reside, if not governed closely. As an example, elephant tusks and white rhinos. Think about elephant tusks and white rhinos. And in the quote-unquote wet markets of Wuhan, we can say with certainty that this practice isn't governed closely. You see, it's not just elephants and white rhinos that are considered cures for some afflictions. There's also the curious case of bats as potential talisman for certain diseases. Reading from the Society for Applied Microbiology, Furthermore, it was investigated which bat species have commercial value in China and would thus likely be handled for trading purposes. A number of coronavirus genomes have been published that were obtained from such bat species. These bats are used in traditional medicine. These bats are used in traditional Chinese medicine, and their handling poses a potential risk to cause a zoonotic coronavirus epidemic. Further, Chinese bat species with commercial value were identified as natural reservoirs of coronavirus and are used in traditional Chinese medicine. Since their trading provides a potential risk for spreading zoonoses, a change in these practices is highly recommended. Right from the horse's mouth, wouldn't you say? But keep in mind this isn't ironclad evidence of the origin of COVID-19. It's just one of many studies trying to understand the origins of possible vectors of transmission for the strain of coronavirus. That said, this is part of a larger pattern of coronavirus transmission. A while ago, SARS, another pandemic originating from a coronavirus, also began in China and started as a virus identified in bats. Another major coronavirus outbreak, MERS, Middle Eastern Respiratory Syndrome, originated in the Middle East in 2012 and was transmitted via a camel. The camel, however, is said to have acquired that virus from, you guessed it, a bat. It would seem, and what the paper is trying to point out, I believe, is that coronaviruses seem to be originating from bats. Bats that are also highly valued in Chinese medicine. So now we get why this can become the Chinese Chernobyl. In Chernobyl, it was a lack of transparency, the lack of appreciation for the power that they wielded that led to shortcuts in the construction and maintenance of a facility that ultimately melted down. This meltdown caused untold damage to millions of lives around the globe. Now, we don't know that this strain of coronavirus originated in China or Wuhan, but all signs are starting to point that way. And if that is the case, the similarities will be glaring. The lack of transparency, the lack of rigor around medical practices, and the lack of regulation of food and medical supplies could, if all these lines of inquiry prove to be true, have led to one of the most virulent disease outbreaks in world history. That leaves us with only two pieces of advice for our viewers. 1. Don't eat bats or use them to cure any of your ailments. 2. Don't even think about missing out on all the timely and relevant content in all things business, technology, or personal finance. You can do that by pounding the like and subscribe button and especially hitting the notification bell to make sure you get every video when it comes out, as we publish them weekly, so you're not going to want to miss out. And be sure to leave us a comment down below on what your thoughts are on the origins of the coronavirus. Is traditional Chinese medicine on a collision course with modern medicine? You decide. And remember, a goal without a plan is a wish. A goal with a plan and no action is a wish list. Take action on your business and finances using the power of technology, and we'll catch you next time. Peace.